This video is brought to you by the TCOM team at Marshall University. Today we will introduce the West Virginia CANS tool and storyboard, explain what they are, and go over how they are used. The CANS, or the Child and Adolescent Needs and Strengths, is a tool used to combine all the important information about your family and store it in one central location. The CANS is a living document, so as your family changes, so will the CANS. In order to score the CANs, your caseworker or service provider will collect information from other sources. Some examples include family, teachers, old assessments or case files, therapists, and court documents. The CANs tool is separated into different domains, but you can think of them as the different chapters of your family's story. The domains, or chapters, include exposure to potentially traumatic or adverse childhood experiences, symptoms resulting from exposure to trauma or adverse experiences, child strengths, life functioning, acculturation, child behavioral and emotional needs, and child risk behaviors. A numeric scale is used to assign a number to each item on the CANs, and each item will either be referred to as a need or a strength. When we are looking at needs, the rating of a 0 would mean no need was identified. The rating of a 1 would mean that there is a history of a need, we want to prevent a need, or we want to keep an eye on something. The rating of a 2 would mean that a need is causing problems and needs to be worked on. And the rating of a 3 would mean that the need is causing serious problems that need to be worked on and addressed immediately. When rating strengths, the rating of a 0 means that the strengths are already being used. The rating of a 1 means that the strength is helpful and can be used. The rating of a 2 means that something could be a strength if we work on it. And finally, the rating of a 3 would indicate that there are no strengths in this area. Let's take a look at Mary and her family. Mary is having some trouble with truancy due to witnessing a fight at school. This is causing tension between her and her family. We will be using Mary and her family as an example throughout the rest of the video. Now that we have went over the CANs, let's take a look at the storyboard. The storyboard is created using the CANS scores, and it is a snapshot of your family's story. The storyboard is used to keep track of the progress made by your family throughout your time in services. While using the storyboard, we should be able to determine whether or not any goals have been established, if any progress has been made towards achieving those goals, or if we need to make adjustments to the current plan. The storyboard can be used in team planning by identifying needs that should be addressed or strengths that could be used. For example, Mary's band instructor might mention that a strength of Mary's is her musical talent, and her therapist might bring up a need that they can address in therapy, such as the tension between her and her family members. The storyboard can also be used for celebrations when any progress is made. When looking at the storyboard, it might feel overwhelming, so let's break it down. The first section you will see is background needs. A background need is something in your life that cannot be changed, but is important to be aware of. It may guide the type of treatment and services that you receive. As you can see, witness to school violence is listed as a background need for Mary. The next section is child needs, which are the needs identified through the CANs that could benefit from support. These needs have been rated at least a 2 or a 3 on the CANs. The rating guidelines are also listed here, just in case you need a reminder of their meaning. As you can see, there is a spot for the item rated, as well as for the first and most recent CAN scores. If you look at the child behavioral and emotional needs item, anxiety, you will see that Mary's first CANs rating was a 3, but her most recent was rated at a 2. This is how the storyboard tracks any progress made by you and your family. The final section of the storyboard is the child's strengths, and it is laid out the same way as the needs. If you look at spiritual and religious, you will see how Mary was able to increase her strength in this area. Mary and her family were able to use the CANs to identify their needs and strengths, and the storyboard to track their progress. With the use of these tools, as well as the support of their service provider, we can see how much their life has changed since receiving services. In summary, the CANS is used to keep information about your family organized in one place. It is used as a guide or a storybook to create a storyboard for your family. And the CANs in your storyboard show you how your family changes over time. Thank you for watching.